Hello. Yes, I am in between patients and I have PPE marks on my face, so excuse my appearance. I'm going to start off the story slam by telling you a story about, I guess, just gratitude. Um, as an internist, it takes so little to make an internist happy. I can list a couple of things that after a long day that make me happy. It's when I can get somebody's blood pressure under control, or if their hemoglobin A1C is under control, or I help somebody to lose weight by giving them some tips, or I start them on an antidepressant and their mood is improved, or I help them to quit smoking, or I convince them to get a COVID-19 vaccine. And I think being an internist is really challenging these days. I have to admit there are times when I feel really despondent about the state of medicine when I have to try and get an MRI approved, or when the EMR totally shuts down. And I do feel moments when I just want to give up. If you ask my family, they'll say, why don't you just quit? You're always complaining about this. And there have been times at work when I've just been so frustrated that I've gone to the bathroom and literally just had a good cry, and then I come out and I go about my day, and I'm sure many of you also have done that. But I think really what keeps me going despite these moments of moral injury is that I love being an internist, and I'm very grateful to be involved in patients' lives. And over the past 23 years that I've been in my practice, I've gotten many letters from patients and cards. And, most of these letters are just letters of thanks, or it could be a letter about patient moving or how they're doing with their health, or just letting me know about what's going on in their lives. And when you think about it, the other thing about me is that I'm a hoarder and I'm very sentimental. So I save all of these cards and letters, and I have all these baskets in my office that are filled with these cards and letters. But when you really think about what's involved with writing a letter, like the patient has to pick out a card, pick out a piece of paper, special piece of paper, select meaningful words, put it to paper. They have to look up your address, write the address on an envelope, find a stamp, get the letter to the post office. It's so much effort goes into mailing a physical letter. And especially I can appreciate that now even more in this time of texting and email. So on days when I'm feeling really frustrated or despondent, sometimes I'll just go to this basket of letters and just select one, and I'll just silently read it to myself. And it really brings me a lot of joy. It brings back memories of patients that have helped, or like if they've wished me well about the birth of my son when I first started practice. And for this, I'm really grateful. I'm grateful for patients who have put pen to paper, and I'll be eternally grateful for the fact that I've been able to be an internist. So thank you for letting me share this story.
I'll tell you about my story. So I actually trained in Barcelona, and between starting my year as a PGY1 and finishing all of the interviews, I had a couple months where I was kind of unemployed. And as a student, I'd actually rotated a geriatrics hospital. And I'd shown a lot of interest and enthusiasm for geriatrics. I really loved it. And I stayed on to do some research. And one of my attendings there actually became one of my mentors. So they offered me a job for a couple months to cover for an attending who was going on maternity leave. And I was both really excited and really nervous because this was the first time I was going to be working as a physician. And I felt like it was a really big responsibility to cover for an attending. So my first week there, my mentor in geriatrics there calls me over and she says, Gabby, there's something I want you to see. And she says to me, I want you to learn like what it's like when a patient dies. And I think this is an important lesson for you to learn. So up to that point in my life, I'd encountered death many times, but never as a physician. So she took me down, she kind of shuffled me into a room and she closed the door behind me. And it felt like at the beginning, it felt like an ambush. And I thought that I was walking into a very intimate moment, because I realized that as soon as I got there, the lights were dimmed, the curtain was drawn, I could see the family was around the patient, and I could see another one of the attendings who was sitting right by the bed of the patient, and she was holding his hand and she was whispering something into the patient's ear. And it was after a really long time that the patient passed away. And I could see that the physician, she got up, and then I could see that the family went over to hug her. They were saying how thankful they were for everything that she had done for them. And this is kind of, for me, the moment that I realized what my mentor was really trying to show to me and how important it was for the family, and what an act of kindness it was for them to be there for the patient as the patient was dying. So it also happened that week that I started working there as a geriatrician, that my grandmother, who was living in Miami at the time, also passed away. And because I was getting everything ready to move to the US, I couldn't travel, and I didn't have my passport. I couldn't travel to see her. But I remember talking with my mother on the phone, and she told me, Gabby, it's okay. It's okay. I'll let you know that I feel like it was okay, because they told me that she was not alone when she died. So now I could see it on the other side, and I could see how it was great comfort for my mother. And I could see that I felt like that was the kindest thing that they could have done for her in that situation. And so now with COVID, I've thought about this many times, and I had a particularly difficult rotation in a subacute unit that we created just for COVID, that eventually shut down because all our patients either died or went to the ICU. And as it was customary, you would call them on the phone every day to update them about how things were going. And oftentimes I saw that patients would ask about their loved ones, and they would wonder, is my loved one in pain? Are they going to die alone? So I thought about all these things that, my mentors taught me in Barcelona, and I kind of made a point to be there for the patient whenever I could, to make sure that before we were intubating a patient, I could call their family member and have them say a couple words before we were intubating a patient that I knew was not going to have a good prognosis. So I think it gives families a lot of closure and a lot of peace, particularly now in COVID, where they can't be there for their loved ones as they're dying, or they themselves can't come to the hospital. So these are some kind of acts of kindness that they've taught me, and I'm now trying to pay forward to as well.
Before I start, I would like to share maybe one or two small incidences, and that is pertinent to our current time. During the time when we have the Capitol riots going on and Republican and Democrats fighting over the Black Lives Matters, Nancy Nielsen, our past AMA president, was receiving an award at MISNI. And she mentioned a sentence which is so pertinent to the current state. And that statement was, you don't have to agree with anything. You don't have to agree with anything to be kind. And that resonates with me all the time. And it is so important. And the second thing which I like to share is what you have started. I really want to commend even the topic. What you've chosen is really, really uplifting and important. So when I was in Assemblyman Godfrey's office, he has a painting. And that painting practically is in calligraphy in Japanese, but the translation is of Robert F. Kennedy when he was giving the speech called Ripple of Hope. And probably that's what you are doing today. And that sentence is Each time a man stands up for an ideal or acts of to improve the lot of others or strikes out against injustice, he sends forth a tiny ripple of hope and crossing each other from a million different centers of energy and daring those ripples build a current which can sweep down the mightiest wall of oppression and resilience. So I thank you for doing this. I hope that this act of kindness, random act of kindness, continue. My story is I'm on the receiver end from so many people having kindness every single day in my life. My story, what I describe as that, have you seen heaven? It is right here. Because in my darkest time, I found the best in the people. When the COVID hit us, I was the acting chair, and we have entire floor of COVID. I was worried about my residents that they will be tired. I go to different floor and I ask that team that, hey, can we switch this floor early? Every single resident said yes. And I said, don't have to answer it now. Let me go. You think about it and then tell us. The answer did not change. I was worried about the primary care will be falling off and then we will be getting sick. Who will cover us? I sent an email on Saturday evening to all the specialists. My request was, can you please cover us in case if we get sick? Either you can say yes column or you can put your name in high risk. Every single high risk specialist put their name into yes column. And when I called in, that 70-year-old nephrologist, Dr. Tricia, said that, Parag, you don't have to worry, I will cover. I can never forget that kind of kindness and compassion in the people. Moving fast forward, I got sick. And when my friend, who is the chief of general intermedicine, found out, he spent 1.5 hours store to store, pharmacy to pharmacy, just to get me a digital thermometer. I was getting short of breath and I asked my friend that, can I have oxygen at home? Dr. Tarun Vasil found a place where he actually purchased oxygen concentrate, delivered to Dr. Pandya, and he delivered to my home. And that's why I was able to stay home. Otherwise, I might have been in hospital intubated. That sickness, when it increased to my wife and my mother-in-law, my 2 daughters, they just took over everything. They cook, they clean, they disinfect everything. And knowingly that my mother-in-law is sick, they continue to help her. That was the kindness. When they all fall sick, my community, somehow they manage to create a WhatsApp group. Each time we open the door, there will be food. And they make sure that everyone has taken turn, so no food is being even repeated. When you open the door, somebody has sent disinfectant. You can imagine that the tissue was the highest priority and modality which was not available. Somebody sent the tissue roll. My mother-in-law was getting sick and she was not eating. My anesthetist friend said, I will come to your home and will give her IV. Another friend sent me the zinc, vitamin C. And while it was getting harder and harder, my chief resident called me and said, do you need anything? And I said, maybe I need a bedpan. And guess what? That bedpan was delivered to me same day in the evening. And those small things continue over and over, again and again, every single time. My mother-in-law got admitted to the hospital and I requested the night nurse, can you please put your hand on my mother's head? She likes that. Can you put your fingers in her hair? And she did it. When I got well, what I found in my darkest time was kindness all around me. And that is where I wrote to my family, my friends, and my hospital. Very simple thing. Have you seen heaven? I found it here in my COVID journey. I truly thank you all for listening to me.
So my name is Adrienne Novick, and I'm going to share a story with you about my social work fellowship at Zucker Hillside in the geriatric partial hospitalization program. I was new and I led therapeutic groups and saw individual patients for counseling. And one of my responsibilities was to complete the admission assessment for new patients. Many of the people I saw were being transitioned from the inpatient psych program into the partial hospitalization. And I really enjoyed the work. I liked talking to people. And after the formal assessment was completed, if time permitted, I had a chance to casually ask patients, what was your experience in the inpatient program? How was that for you? And people shared all different types of stories about their lives and their experience in treatment. So the first time a patient mentioned a staff member named Carlos, I nodded my head, and I was still pretty new, and I used that line I had learned pretty recently, tell me more, and feeling very proud of myself. And he told me that Carlos would talk all about baseball. Carlos knew all the stats. He would tell me he even knows the players from back in the day when I was young. And I said to myself, wow, that's a great therapeutic tool to engage with patients, to talk about something that they have an interest in. And I had learned the concept of meeting a patient where they are and engaging with them. And I thought I could add this to my skills. Although I have to say, I wasn't sure how I would ever be able to remember baseball statistics, since I have a hard time remembering where I park my car every morning when I come out of work. So, but that being said, I figured I could try, and I could try to learn a few old players' names and what teams they played on, in the interest of engaging with people in my program. So then what happened was the next week I was assessing a new patient, and without my asking, she mentioned Carlos. She told me when she was admitted inpatient, she wasn't feeling well, and she was in her room, and she could hear Carlos singing one of the songs in Spanish her grandmother used to sing to her. And I said, wow, that's kind of unexpected. Singing, maybe it's an unconventional approach to patient care. And she went on to tell me how this song really warmed her heart, and it really helped her to feel less anxious and more comfortable as she began the program. So I was like, okay, I was learning. I was still a fellow. I'm still learning. The very next day, I was talking to a patient about treatment during a counseling session. And as usual, I asked, so what did you learn from their inpatient program that you could bring into your daily life? So she told me she learned it was okay to ask for help. So I said, well, let's talk about that. How did you learn it? So she told me the story of how she was going down the hall and her cane had slipped out of her hands when she was walking, came crashing to the floor, and she was standing in the hall alone, trying to figure out how she could bend down to pick up her cane and just to do it safely. And Carlos happened to be going down the hall, and he noticed her. He paused and he asked her if she needed anything. And she pointed down to the floor and told him she was trying to figure out how to pick up her cane. So he said to her, why don't you just ask for help? And as simple as that, she asked him for help. And she told me that she will never forget that she learned that sometimes it's just okay to ask for help. So 3 mentions in such a short time, I started thinking, who is Carlos? I should go meet him and learn about his training and see if he'd be open to me asking him a few questions about techniques. So on that fall day after work, I walked across to the Zucker Hillside campus, and I went to the inpatient program to see if I could find Carlos. I rang the bell and I peered into that little camera after you push the call bell so I can enter the lock unit, and I got buzzed in, and the door closed behind me with a heavy thud for the lock units. And I went to the nurse's station and I asked if Carlos was around. I said I'd like to speak to him if he had time. So the nurse looked up sort of over her glasses, like this. And the nurse looked up and she looked puzzled. She said, Carlos, you want to speak to Carlos? And I said, yes, please. I've had several patients mention him and I wanted to find out about his techniques for patient engagement. So she called on the overhead speaker, Carlos, can you please come to the front? Carlos, please come to the front desk. So I could hear footsteps heading my way and I was excited to meet him. I was thinking maybe I'm going to be meeting my future mentor. And Carlos walked up to the nurse's station and he asked, how can I help? What can I do? And she pointed towards me And to my surprise, I discovered that Carlos was part of the maintenance team, that his random acts of kindness had touched patients, and he changed my clinical practice forever. I learned to meet people where they are. I learned that music can be a comfort in times of trouble. And I learned to keep my eyes open for unexpected opportunities to help people. I learned that some of the greatest gifts can come from unexpected places if I take the time to notice. And for that, I say, thank you, Carlos.
So there is a famous quote that states, kindness begins with the understanding that we all struggle. As physicians, we enter a doctor-patient relationship not to solely treat a disease or illness, but to care for someone suffering. For some patients, especially throughout the COVID pandemic, a point is inevitably reached when there are no more options for a cure. But that doesn't mean that our role is done. I would like to share with you the story of two children, Aiden and Zoe Taylor, and the Heidi's Helping Hand Legacy Building Program at Plainview Hospital, which is one of the hospitals that I work at. And that story is proof of the power of empathy and what those children have done. For Aiden and Zoe, what began as an average November day and a school day back in November, just before the pandemic, it quickly turned into the worst day of their lives. This was a traumatic day where they were forced, unfortunately, to witness their mothers actively dying in a frightening intensive care unit. And this is a place that they've never ever seen before, only maybe on TV. The care team acted at that time swiftly and gracefully. They cared for their mother and at the same time provided compassion to those children. They provided tangible items in forms of plaster, hand molds, and ink prints, tried to give some memorable items to those kids before the mother passed away. And those kids decided to hang on to the light and compassion that was shown to them at that time and to spread that love to others. Shortly after their mom passed away, the family reached out to set up a program that will allow other families to have the same creative materials and more to help other grieving families throughout their grieving process. It initially began with just a small program to support children who were losing parents or grandparents. However, the Taylor family quickly afterwards expanded that program and made it available to anyone of any age group. And their mission statement stated, Heidi was the most fun and creative mom out there, and we want other families to have the opportunity for comfort, closure, and closeness as we did in our toughest time. Every family deserves a chance to heal through crafting while their loved one is in Plainview Hospital. So their story really touched me, and and it affected me in many ways, because those children are very special. They acted with such grace and generosity in the face of this extreme adversity, and they gave me this greatest inspiration that I learned a lot from. And especially that for us as medical professionals, we often build walls that protect us, especially in this COVID pandemic. And these walls allow us to do the unthinkable things that we often have to face. And I feel that, with the COVID pandemic, it has taught us that, unfortunately, there is a fragility to life and that there is importance to connection. And what we can learn from those children and also from the community members that helped them, those that donated money and time to that legacy building program, is that kindness can change people's lives. Those small acts of kindness and humanity and empathy were never wasted. And especially more so with the COVID pandemic and visitation and restrictions, this program has actually made a huge difference to so many patients and families who were unable to visit. So what we have in place now, we have fingerprint lockets and necklaces. And we have been using these to provide to family members after they lost their loved ones. And we continue to receive positive feedback from families who have participated in this program. We have people from all ages with all different relationships, and they all now carry this small piece of their loved one with them as they navigate through life. The other part where I really had this experience with, we work closely with the patient experience team at Plainview Hospital and the clinical teams throughout the whole hospital. And everybody has been working together on trying to continue this legacy building program and help get all this done for the families and the grieving families. And one time I was taking care of a patient, a COVID patient in the ICU, who was leaving behind an only child. It was an adult daughter who was struggling really hard, about losing her mother. My team, together with the patient experience team, we offered her the fingerprint locket. And she was extremely moved and appreciative of having something of her mother's at this time. And to me, I felt that as the patient was nearing her end, because the daughter had a piece of her mother close to her heart, she was able, maybe a little bit better to, grieve her mother's death in a little bit more of a peaceful way. And because I witnessed this small act of kindness, it reminded me that we as clinicians, we are our patients' biggest advocates, and that we can continue to advocate for our patients and their families, in this special way as well, which expands beyond the clinical care that we provide. And I wanted to share that story with you. Thank you.
Hi, everyone. Good afternoon. My name is Elizabeth McCormick. I'm the Senior Manager of the Palliative Care Unit. Thank you so much for having us tonight. This is Shirley Valeri. She is an experienced and exceptional registered nurse on the Palliative Care Unit. And tonight she's going to be sharing a beautiful, positive story about our honoree, Tricia, who I just told that she will be having this beautiful experience tonight. So Shirley, I'll let you take it away.
Thank you. Okay, so my name is Shirley. I've been with Palliative Care Unit since it opened in 2007. I'm still one of the original nurses there, and I love doing the work of being a palliative nurse. It is hard, it is sad, but it's also rewarding to be part of someone's life when they're at the end of life. I met a young lady by the name of Tricia at another facility, and I fell in love with her because I knew she was going to be perfect to be part of our palliative team. So I asked her to join us, and she did. So I want to tell you a little bit about Tricia. I just wrote a little something about her. Tricia Montague is an exceptional registered nurse on the Palliative Care Unit. She continuously showcases her touch of love and advocates for her patients. Tricia demonstrates empathy, compassion, and dedication to her team members. Tricia has gone above and beyond for each of her patients, but goes extra mile when her patients are going through a difficult time. Tricia has brought clothes for patients on the unit who would otherwise have nothing. She even coordinated deliveries to these patients when she's not working. Tricia begins each shift with a positive energy and is a shining light to those who need her in their final moments. She recognizes their needs and proactively soothes their symptoms. Tricia is a blessing to the Palliative Care Unit. I am proud to have her as my friend, my best friend, and she does bring happiness and joy, even in a sad situation, and I wouldn't have it any other way. So congratulations, Tricia.
Thank you, Shirley. Thank you so much.
Hi everyone, I'm Zoe, and I'm a third year resident at Sinai, and today I'm going to share a story about earnest gratitude. So last spring, like so many unsuspecting areas of our hospital, the endoscopy suite was turned into a makeshift ICU. Machines were moved, offices were displaced, and plastic walls were put up. This makeshift ICU had 2 rooms. And by happenstance, when I was scheduled to rotate through the endo ICU, one room was filled with actively dying patients, but the other room was filled with patients that were very ill, with COVID, still ventilated, or some complication thereof. But they were stable, and many of them had real glimmers of hope of recovery. I was lucky to be assigned the room where the patients had a chance of recovery. I had 6 of them to start, and slowly but surely, many of them got better, and they were transferred out. We were able to wean them off ventilators, get them awake enough to speak to their families for the first time in months, and in many cases, transfer them to rehab. I remember covering overnight once and hearing yelps and screams of joy as some of the patients were able to Zoom with their families for the first time since they've been admitted to the hospital. And in that room, I will never forget one of the patients that I cared for. We'll call her Mary. Mary suffered from a very severe case of COVID and had been admitted to the hospital for months. She had a trach for oxygen, a peg for nutrition, but like so many, even though she was awake sometimes, she had been medicalized enough that I didn't really feel like I knew who she was as a person. She also had many comorbidities, and the odds for her recovery were against her. Medically, however, we were achieving our goals. We weaned her off sedation and were titrating down her oxygen requirements. Mary was also very lucky to have a very devoted sister who called every day. First, she would call me for an update, and then I would set up an iPad beside her sister and they would chat for a while. Her sister would call from anywhere and everywhere. Sometimes she was biking on the Hudson River, sometimes she was grocery shopping, but nonetheless, she was there virtually for her sister every single day. And she had a positive and grateful attitude that was much appreciated by everyone. Mary's sister would also mention things that had never crossed my mind. Like she asked me, does Mary have her glasses? And does Mary have her phone? And I had no idea that Mary wore glasses. So we found her glasses and they were very thick and we would put them on Mary. And lo and behold, after weeks, she was able to see for the first time. And then the next time I walked by the room, she was texting. And despite these small steps to recovery, Mary was having a hard time getting off the ventilator. Her diaphragm was weak and she was very anxious. And so every time we would try and wean her off, her heart and her respiratory rate would spike. And we tried and tried without success. And I was giving Mary's sister an update one day. And despite my hesitancy, Mary's sister assured me that Mary was going to get off the ventilator. She had no doubt. And she asked me the next time that we tried to do a breathing trial if she could be there beside her sister on the iPad. And so I coordinated the respiratory therapists and the iPad, or Mary's sister on wheels, and we all went together to see Mary. And when it was time to switch the ventilator settings, Mary looked at me and she looked very anxious. And right on time, Mary's sister looked at her and she started cheering. And then the respiratory therapist started cheering. And then we were all cheering. And before we knew it, the ventilator settings had been switched and Mary didn't even realize that she was breathing on her own. And a few minutes later, she took my hand and she mouthed, "I love you." And then she took the hands of the respiratory therapist and mouthed, "I love you." Mary had a sister who cared and believed in her deeply. And Mary did us a grand act of kindness of expressing a genuine thank you.
I'm a prelim resident in Dr. Friedman's program going into ophthalmology next year. And I just wrote a small snapshot of something that happened to me at the ICU, which was probably the toughest 2 weeks that I had this year. Okay. Time of death was 3:19. Not an hour before, I called her daughter, telling her that her mother is doing better and planned to be transferred from the ICU. After 10 minutes of chest compressions, I felt the sweat running down my neck. It was my first. How am I going to call her now? When she and her siblings came to say their last goodbye, I was uneasy. She felt I was mourning. She gracefully thanked me for taking such good care of her mom. I was speechless. By sharing her grief with me, I was able to heal.
So actually had a different story planned, and I was so inspired by all of you that I thought I would talk a little bit and return to the theme from the beginning of the evening about being an internist, since this is sponsored by the ACP. So I think all of us know that being an internist is super rewarding, but being an internist is not easy. And internal medicine is tough, and it can be isolating sometimes when you are alone trying to do reading, work on pre-authorizations, write endless numbers of notes, right? And I think it is the relationships with each other, the relationships with our patients, and the continuity that keeps us going. And one of the things that I've learned here at Northwell is that being an internist can also mean you're a member of a team, and internal medicine can be a team sport. And we can enjoy playing this and being part of people's lives together. And one of the best experiences that I've had here at Northwell is with the IMPACT program, which is our interprofessional training program. IMPACT brings me and several of our faculty, including Dr. Zucker, students and staff, joy, and seems like the way that medicine should be practiced. And we talk a lot in IMPACT about the fact that the combination of pharmacists, psychologists, PAs, physicians, our medical assistant, and the students makes a difference. And I hope that it does. But while all this is true, I think that that what we do is often overshadowed by the true hero of our program. And our colleague Ilda Flanagan, I think, is that hero for our patients and provides undeniable courage and kindness every day for our patients. So she's been here at Northwell for 17 years. She tells us the story that she was working in an outreach program in a church in Port Washington when she happened to meet the medical director of the residency clinic at that church outreach event, who was looking for a secretary to work at the clinic. And Ilda and another member of the outreach team at the church agreed to come to work and sort of try their hand at medical care. They'd never previously worked in healthcare. And that was 17 years ago, and Ilda has been continuously at the clinic ever since. And what I find so amazing about Ilda is that she goes out of her way every day for patients. People call her, they know her. She speaks English, she speaks Spanish. She knows everyone's family, where they live, what barriers they face coming into the clinic, who will be late and why, when they need to come in, what's going on in their lives, how to help them navigate their way through that. She seamlessly integrates herself into the conversations to allow us to perform our job as physicians and pharmacists and psychologists, while also quietly advocating for the patients so that they each receive the phone call that they need, the appointment that they need, or maybe just a little bit of grace from us if they arrive late because of all the barriers in their lives. She also makes sure she takes care of the whole medical team. So if she knows that somebody has an important event coming up or somebody isn't feeling well, she will also quietly endeavor to make sure that that person has a little extra time, has a little bit of a different schedule to make sure that they get what they need and that any burnout that anyone on the team is feeling is washed away. She brings us holiday gifts. She brings food when we need it. She decorates the office with the tiny pictures of the faces of every graduating resident without being asked to. So you get into the office and there are just photos everywhere. It's slightly creepy of the graduating resident, and it changes every week in honor of that resident's graduation. And one of the things I've been amazed about is how she can magically get patients into follow-up with any specialty at exactly the right time. And I recently learned from her how she does this. So she brings gifts and gets to know people at each of the specialists' office. So the pulmonologists and the geriatricians and the nephrologists. She will come with a holiday gift. She will bring it in person, get to know the people there. and she'll make friends. And then once these people know her and love her as we all do, then whenever our patients need to see a pulmonologist or a nephrologist or a geriatrician, she says, no problem. She calls up and they say, well, Ilda, for you, anything, and she will get them in the very next day. And it not only helps our patients, it helps all of us sleep at night knowing that our patients are getting the right care. So I think I've learned a lot of lessons from Ilda, including the power and value of relationships and cultivating relationships because of the relationship itself, as well as the help that it can bring to so many others. Ilda has been out on medical leave for the past 2 months, and we've missed her incredibly. And so in writing this, I was hoping to wish her a speedy recovery through the barriers in her life. And I know I am not alone. Our residents recently showed how much they treasure her, and I think she's just a role model of everything that we are trying to do in healthcare. So Random Acts of Kindness, I think, can find us anywhere. And when you find somebody really inspiring, I think it's important to take note of them.